have Alice Herrera and Bronte Laksamana from Business World, Angela Cruz and Rory Visco from Business Mirror. We have Tony Arsenal from Filipino Mirror, Gina Mape of DWWW. We have Cheryl True from Panay News and Radio Kahilwayan 107.6 FM. We have Bedelin Aguas from the bedelinaguas.com, Gab Diaz from Manila Republic, Larissa Diaz from Larissa Garcia from larissagarcia.com, Angeline Demo from Mommy's Mag Life, Ruel Umali from ruelumali.com, Jing Javier from AmazingJingJavier.com, Rain de Ocampo from raindeocampo.com, Lou Ventigan from lemongreentph.com, Kathy Keningo from pst.ph, Oscar Bornea from daddyosk.com, and Millet Season at millet.season.me or astig.ph. So thank you for taking the time off your busy schedules to join us. So before we start the webinar, just some house rules. Kindly display your full name and the organization you're from so we can properly acknowledge you. And please keep your microphones on mute and cameras turned off while our speakers are delivering their statements and presentations. Please send a private message to me if you wish to ask a question so that, of course, I can properly acknowledge you. And if possible, please turn on your camera when it is your turn to ask your questions, and don't forget to unmute. Please be advised that we will be recording this webinar, so kindly message Joanna Viera if you wish to have a copy of the recording. And lastly, please message us if you need additional documents for your reference. So I think we have additional media friends. So thank you for joining us from Orange Magazine, Jaman Villanueva, from Malaya, Edison Gonzalez, and Daily Tribune, Christine Paula Cana. So as you know, the rainy season is here once again, and while a number of us enjoy the cooler weather, the fact of the matter is the rainy season brings a number of illnesses and diseases that could jeopardize our health, especially the most vulnerable in society, our older adults or senior citizens. Please note that we will be using the terms older adults and senior citizens interchangeably. So this morning, we will have a very exciting, informative, and educational discussion about the effective ways to protect our older adults during the rainy seasons, as we are joined by esteemed experts who are true champions of the welfare and well-being of our senior citizens. So to start the program, we have with us the founder and executive director of the Philippine Foundation for Vaccination. She is also a convener of the Vaccine Study Group of the National Institutes of Health, Professor Emeritus of Pediatrics at the University of the Philippines, Manila. She is also the executive director in Asian Society for Pediatric Infectious Disease and International Society of Tropical Pediatrics, and also the president of the Immunization Partners of Asia Pacific. Please welcome the inimitable Dr. Lulu Bravo. Thank you, Dr. Lulu, for joining us. Hi.
Hello, and thank you very much, Steph, for that very nice introduction. And of course, our sponsor for giving us another opportunity to have you with us, the media, the people who can make the most out of our information campaign about vaccination and also protecting not just the adults, but also the elderly. You know, I'm very happy. We are just beginning the week. It's Monday. And what a way to start the week, but by talking to you. You know, I always respect the media. Media who has really at heart the interest and welfare of our Filipino citizens. You know, the Philippine Foundation for Vaccination was founded in 2000. And that was because we responded to the call of Gavi, Bill and Melinda Gates. Because at that time, global health was being developed in such a way, they knew that vaccination was being credited as 95% of global health. There was, in fact, very little profit from vaccination, but there was so much that vaccination can give in terms of prolonging life, saving lives, and not just that, saving the economy. By now, you should have realized that after the 2 years of COVID, we should have known why the elderly are being prioritized. Because just like, I'm a pediatrician of 45 years, sorry. And I've been a vaccinologist for almost the entire time of my career as a pediatrician. And during this time, we have realized the enormous capacity of each and every one to talk about protection, to talk about prevention. You, of course, know that it is so much easier to prevent and not get sick and spend so much for hospitalization, wherein you will have to lend, you will have to borrow money to be paying the doctors, the hospitals, and everything. Whereas just a vaccine may be able to do that. And mind you, there were times before when people did not realize that elderlies and of course those with comorbidities were dying not because of their age or because of their comorbidities, but because they were having flu, they were having pneumonia that could have been prevented. And this is what I would really want each and every one of you to take from this session that we are having. Of course, I am so grateful to Dr. Remedios Coronel, who in 2003, when she was the president of PISMID, founded the ad hoc committee on immunization. And I was made the ad hoc chairman. Remember, Dr. Coronel? You were the president of the Philippine Society of Microbiology. When PISMID started to give credence to immunization for adults, because at that time, only the children were being given, things to save their lives. They didn't realize then that, of course, adults and elderly are also needing protection. And it took a long time. In 2010, when then President Pinoy signed a Republic Act called the Senior Citizens Act of 2010 that actually gave free immunization to elderly, indigent ones who cannot afford to go to private clinics to get their flu, to get their pneumococcal vaccine. And that is something that we really have to remember, that it took some time before people realized that vaccines for elderly, for adults are important. And I'm thankful to Dr. Poblete from the geriatrics community. And of course, my good friend, Dr. Jean Solante, who was with me all the time during our PISMI days, when he would also take up these cudgels for adult and elderly immunization. And with that, I really thank all of you to really make sure that after this, you will take home the message that prevention is much more than a pound of cure, as they say. Who would want to get hospitalized? Sometimes you don't thank your doctors for giving them the prevention and the protection. You thank them when you are treated for the illness. My God, when you have had the chance to prevent it, come on. You don't want to get to the hospital. You want not to be in the hospital. And doctors who can prevent the disease are much more superior, much more responsible than those who will treat you. So thank you, and over to you, Steph.
Thank you so much, Dr. Bravo. We always appreciate your passion and dedication in helping improve the welfare of our older adults through vaccination. So before we move on, we also would like to acknowledge another media friend from GMA7, Mav Gonzalez. Welcome, Mav. Thank you for joining us. Long time no see. So now on to our first speaker. So she will be talking about the current state of health of older adults in the Philippines. She is the former president, the council advisor, and the former chairperson of the Standard Committee on Adult Immunization of the Philippine Society for Microbiology and Infectious Diseases, or PISMID. She is the founding member of the Philippine Foundation for Vaccination and the Philippine Hospital Infection Control Society. She is also the chief of the Infectious Diseases and Active Medical Staff section of the UST Hospital. Ladies and gentlemen, please help me welcome Dr. Remedios Coronel. Dr. Coronel, thank you so much for joining us and welcome. Doctor, I think,
Okay.
yeah, okay, perfect.
Yeah,
Thank you for joining us, Doctor. Good morning.
Good
You may now
morning.
have-
Thank you for your invitation, Steph. So my talk, can you share my slide?
We are presenting it, Doctor, now. There. Can you see it, Doctor?
Yeah.
Okay.
So this is my talk, current state of health of the older adults in the Philippines. Next, please. So this is a study wherein the key statistics on the Philippines population of older people was made, and it was found out that population age 60 and above in 2019 accounts for more than 9 million individuals, and by 2050 it will double its number. And the life expectancy of the males became higher, and so with the females. And the population in terms of percentage of people age 60 and above in 2019 is 8.6. And for 2025, it will become at least 10, and 2050 double again. Next, please. So Filipinos are living longer, but in poor health, as the country nears a demographic transition, which leads to aging population, because it will double then. So older Filipinos are expected to account for 10% of the population by 2025. So 3 years from now, from the current 6 to 7%. As I've said earlier, lifespan for Filipinos is longer, 67 for females, 72 to 75 for females, due to modern technology. Next, please. So these are the diagnosed illnesses among those people, older people, which were studied. And you can see, especially in group 1, that cataract, as you grow older, is highest in its prevalence. That is due to aging. So in group 2 of individuals with these different diseases, hypertension has the highest prevalence of 46%. Diabetes, myocardial infarction or angina, renal and urinary ailments are the next highest. And for all of these diseases in group 1 and 2, there is no discernible pattern in its prevalence by age. But it was found out that the 4 diseases which I have mentioned have highest prevalence among women. Next, please. So more than half of the older Filipinos have at least one of the risky comorbidities for COVID-19, like diabetes, hypertension, renal diseases. And most women, 61%, than men have at least one condition. And those in the youngest age group of 60 to 69% have the lowest percentage reporting at least one condition, which I have mentioned earlier. By socioeconomic status, the percentage with at least one disease condition is highest among the upper 20% of the population, of about 71%, and the lowest among the poorest, 20%. Next. So according to the DOH, the cause mortality top 20 diseases in the Philippines from January to October 2021 showed that the top 3 causes of death in 2021 were the ischemic heart disease, cardiovascular diseases, and COVID-19 virus identified. So influenza is a health burden in the Philippines. This is what Dr. Bravo has emphasized in her opening remark or welcome remarks. So the excess mortality in patients age group more than 60 or more, if they are having both influenza A and B strains, have an excess mortality of 67.1%. And if you have just influenza A strain, your excess mortality is 66.8%, and influenza B, 68.8%. So pareho lang siya. So influenza-associated excess mortality is highest for individuals 60 and above and in children less than 5 years of age. Next. So influenza is not just a respiratory disease, because in influenza you have cough, you have colds. It has a serious complication. You can see here in this slide that if you have influenza, it can complicate your CNS or your neurological complication, which is 8 times increased risk of stroke. And you have lost your autonomy because of your immunosenescence or frailty. So you are less independent by 23%. And if you are diabetic, you have 75% increase in uncontrolled glycemic events, wherein your blood sugars will be always elevated. And it can complicate your heart cardiovascular disease, giving you 10 times increased risk of heart attack. Now, if your lungs are involved as a complication, you have 8 times increase of pneumonia when you have influenza. Next, please. So these are the leading causes of death. I have told you already, heart disease. But then here, you can have your pneumonia, the orange lung. Next. There was also a study wherein the people were asked about their awareness on flu and pneumococcal vaccination. Those who were studied that were aware and vaccinated accounted just for 10.7%. Those who are aware of these vaccines but not vaccinated accounted for 18.9%. And you can see how big is the difference for those individuals who are not aware that there was such a flu or pneumococcal vaccines to be given, 70.4%. That is for influenza vaccine alone. And we have also on pneumococcal vaccine, wherein those who were aware and vaccinated accounted for 27.1%. Those who are aware but not vaccinated, 19.3%. And those who were not aware that they should take pneumococcal vaccine were not aware that there was such a vaccines for pneumonia, accounted for 59%. So what does this mean? There was underuse or underutilization of these vaccines for adult immunization. That was our advocacy then in PISMID when we established the ad hoc committee on adult immunization. And it means also that the primary care physicians taking care of the older persons did not mind, or maybe they are not also aware that they should give these two vaccines among their patients who are older people per patients. Or that was the reason why we created the ad hoc committee on adult immunization, because as Dr. Bravo has said, the government or the policymakers were just concentrating on the expanded immunization program for children, but has ignored adult immunization among the elderly especially. So that is also the reason for these statistics. And even the physicians themselves, even the private physicians, don't want to or are also not aware that they should give this to their older patients. Next, please. Why should we give these vaccines? Because as you grow older, due to aging, you have the so-called immunosenescence, wherein your response to vaccination is poor because your immune response or immunity has declined due to aging. And this makes you vulnerable to these diseases. And also, when you age, there are underlying conditions or comorbidities like diabetes, cardiovascular disease, CNS, kidney diseases, respiratory diseases like asthma and others. There is also polypharmacy. Older people are taking so many drugs for their comorbidities. And of course, frailty. These patients will have a reduced autonomy. They are already dependent to others for support, and even in their functional and cognitive functions. And there is increased hospitalization and increased mortality if they will get the disease, especially influenza. I have told you already the complications of influenza. So responses to antigens are lower. So I've already said what is immunosenescence. And what is important is to increase or enhance the influenza vaccines that are to be made because of inflammaging, wherein the older people has a tendency to be in a state of chronic, local, and systemic chronic inflammation. So in the manufacture of new vaccines, they should also take into consideration the age of the patient, the adjuvants to be added. It should be more to increase the antigenic response of the individual and the other immunological, social, socioeconomic, geographical history of each individual. So that is to be put in mind by the manufacturers for next generation vaccines production. Next, please. So this is a data from DOH, from the epidemiology unit of the Department of Health. You can see here that in 2015, they have started giving immunization for influenza pneumococcal in senior citizens who are indigent, 60 years and above. And you can see 2015 to 2021, it has not increased but has decreased, especially in 2018 for influenza. But 2019, 20, and 21, status ko lang ang number of senior citizens indigent at that 60 and 65 years of age, given influenza and pneumococcal vaccines. So it has not reached the target to that is set by the Department of Health. Sa pneumococcal, 2021, 54.5. Understandable din yan because of the pandemic that we have, especially in 2020 and 21. Hindi na tumaas. Next. So what are the challenges of influenza vaccine? 2 to 10% of vaccinated individuals are able to produce adequate levels of antibodies following vaccination because of the genetic characteristic of the individual, the state of immunity, wherein they are stressed, obese, nutritional deficiency, they don't eat much, or if they are having previous contact with closely related viruses, and aging because of immunosenescence and frailty, and again, the comorbidities. Next, please. So, to address the decline in immunity of the older people, we have the so-called enhanced influenza vaccines, wherein higher antibody levels should be made and should have less influenza illness. Better efficacy compared to the standard vaccines, fewer respiratory-related and all-cause hospitalizations, reduced healthcare costs, disease protection, and reduced risk of complications, and fewer serious cardiovascular, respiratory, and CNS events. So strategies to overcome poor vaccine effectiveness in the elderly: increase the dose of your hemagglutination antigen within the vaccine, because higher ACE inhibitors titer, the vaccine will be more immunogenic and more effective. Changes in the vaccination route. Now we are giving IM route for influenza vaccine, but they are in having an improved immunogenicity by the intradermal vaccines. Before we have this, pero ngayon, aywan ko kung bakit nawala. And we have also the intranasal vaccine, pero wala pa. And then, as I've said earlier, addition of adjuvants to improve the immune response compared to the trivalent inactivated influenza vaccines in the elderly. So these are the types of enhanced influenza vaccine products: high dose, adjuvanted, and recombinant. But sorry to say, wala pa dito sa atin sa Pilipinas. Next, please. So the current licensed vaccines' protective efficacy varies from year to year, depending on the antigenic match between the circulating viruses and the vaccine strains. So you can see here in the slide, from 2009 to 2019, yung blue lines, yun ang efficacy ng vaccines that were given then. But in 2015, sobrang baba, halos walang silbi yung bakuna na yun noon because of mismatch, meaning the circulating virus during that time that was isolated in the whole world did not match the vaccine strains or the strain of the influenza that was contained in the vaccine. But remember that it's not only due to the efficacy of the influenza vaccine that is important, but your host immune status is also important for efficacy of the vaccine, especially in those individuals who have comorbidities, who are more susceptible to influenza-related complications. Next. So in the Philippines, we don't have yet the enhanced influenza vaccines. We only have the trivalent or quadrivalent flu vaccine. Next. What we are sige. Now, next please. The influenza vaccine has strains influenza A and influenza B. For yung mga A, H1, H2, N1, ganyan-ganyan. Pero yung influenza B, we have two lineage, the Yamagata and the Victoria. So they are circulating in the world. Next, please. So this is the FluNet data showing that in Asian countries from 2010 to 2018, that 31.4 to 32.5% were due to influenza B, either Yamagata or Victoria. So yung vaccine can contain 2 influenza A and 1 influenza B. So kung yung influenza B doon sa circulating around the world was Yamagata and the content of the vaccine is Victoria, there will be mismatch. So the efficacy of the vaccine is not good. It's very low efficacy. Pero kung parehong Yamagata, parehong Victoria, okay, maganda ang efficacy ng vaccine. Okay, next. So since 2006, you can see here, yung red ones are the A, the blue ones are the B. So habang tumatagal, 2007 hanggang 2011, mas marami na ang B kaysa sa A. Next. This is the same, the number of specimen positive from influenza by subtype. Subtype B are the orange and the blue one and the green one are the A type. So, tumataas talaga sila. Especially yung noong 2019 and 18 yung B type. Next. I think that's the last slide for the influenza. However, there was a question on what are the 3 or the vaccines that are to be given to the older people. Aside from pneumonia and influenza vaccine, tetanus vaccine at Tdap, or tetanus diphtheria pertussis vaccine, especially the pertussis component of the Tdap, is important to older people, especially when they have small children and they are also a part of the caring of this child because they can infect the infant. And also herpes zoster vaccine, especially on those people who are already 60 years and above because of the decline in the cell-mediated immunity. So how can we protect these older people during the rainy season from, that is the last question. I just want to emphasize that during rainy days, if you have especially wounds on your legs, not to wade in floodwaters because of leptospirosis. I think that's all.
Thank you so much, Dr. Coronel, for that very informative discussion about the current health of our senior citizens. So our media friends, if you have any questions, please reserve it for later as we will have a Q&A session with our esteemed speakers. So now let's move on to our next speaker. He will be talking about the Philippine College of Geriatric Medicine's efforts in protecting older adults against vaccine preventable diseases. He is the head of the Geriatric Center of St. Luke's Medical Center in Quezon City, the president of the Philippine College of Geriatric Medicine, a board member of the Philippine Society of Geriatrics and Gerontology from 2016 to present. He is also the past president of the Philippine Society of Geriatric and Gerontology from 2012 to 2014, and a member of the Philippine Board of Geriatric Medicine since 2013. Please help me welcome Dr. Eduardo Poblete. Hello, Doc. Thank you for joining us.
So, we meet once again. Thank you. And I'd like to thank also the press that's with us for allowing us to share our expertise on the topic and joining us, hopefully, in the advocacy against influenza diseases. So I'd like to share my slides, please.
Sige, Doc. You have access po. Doc, let us know lang if you need help. Okay, there. Thank you, doctor.
I do.
We can see the screen, but it's a little bit blurry.
Yeah, it's a bit blurry. Screen broad. Ay. Wala eh. Kaya pareha?
Yes, Doc. I think, okay, Doc, would you need help in presenting your slides? You can just email us
Yes,
the...
please.
Okay, sige po.
Okay.
Sige, you can just email us the slides and then we can present it for you. So to our media friends, we're just having a bit of a technical difficulty. We'll fix it as soon as possible. Doc, let us know lang po if you've emailed it already.
Yeah.
Thank you, doctor.
Yeah. Okay, send it to you. Send you a copy.
Thanks, doctor. Checking na po. So to our media friends, just hold on for a while. We're fixing the technical problem. Thank you for your... Doc, we are just refreshing our emails. As you know, internet connection is not so
Yeah.
fast here. So
Okay.
yes, just a few moments. I'm sure like our media friends are very excited to see what you'll be presenting and to hear about your thoughts and your efforts in the PCGM about our flu immunization for older adults. There. Okay, can you
There,
see?
okay.
Okay,
Yeah.
perfect. So the floor is yours, Dr. Poblete. Thank you so much.
Okay. Thank you for this opportunity to present to you what we're doing about the advocacy in protecting the Filipino older adults. Okay, before we go into that, we'd like to refresh you on the current state of immunization as to the COVID vaccination. Next slide, please. Okay, so at the moment, as of June 1, we have about 71 million completed doses of immunization with the COVID vaccine. And however, at the same time, we only have about 14 million who availed of a booster dose. Next slide. Next, please. In the NCR, we have a total of 24 million who availed the vaccine. And the same is true with the senior citizen A2 classification. About 8 million have completed the doses. However, only about 2 million availed of the boosters. Next slide, please. Okay. This graph shows us that pneumonia remains to be among the top 10 leading causes of death among people in the Philippines from 2009 to 10 years then. Okay, next slide. Next, please. In the pre-pandemic Philippines, it is worth noting that even communicable diseases rank in the top 3 mortality. And the trend is, the morbidity also has the same pattern, where pneumonia ranks one among the top 10. And half of these top 10 morbidity cases are actually infections. And by sex, on the average, the female, more females are affected than the males. Next, please. Okay. The peri-pandemic Philippines, top 20 all causes of mortality from January to December of 2020 to 2021. This data is as of January of this year. We will see that respiratory infections like COVID remain to be in the top 10 causes of death in the Philippines. Next, please. Now, this is among the favorite slides. I've seen this slide earlier also with Dr. Coronel. We would like to highlight that only that 70.4% of Filipinos are still not aware that there's an existing flu vaccine, and about 60% are not aware that we have a pneumonia vaccine existing. So this actually is the bedrock of the reason why we need education and why we vouch for education to be one of the primary targets in strategies on vaccine awareness and vaccine utilization. Next, please. Next. Okay. Let's go into the efforts of the PCGM. The Philippine College of Geriatric Medicine, founded about 2012, recently concluded a workshop where we made a statement and policy for different sectors of the society. And to sum it all, is actually part of a holistic approach to try to promote the health and the well-being of older Filipino adults by promoting vaccine confidence among the elderly, by promoting preventive medicine, including fall prevention, vaccination, self-care, and maintaining functionality above all. We would also like to promote an active and healthy lifestyle, including the regular physical activity and healthy food or diet. And we support compliance with medication and other medical interventions, and to promote mental health and well-being, and to promote sustainable living and healthy environment for all Filipino adults. And this we'd like to spread to both nationally, in the national and local government. Next slide. Next, please. Extending to communities, families, and the caregivers, even to scientists, researchers, and to you, the media organizations in the country. So we hope that with these statements of support and policy recommendations, we would be able to further enhance our strategies in combating the influenza and pneumonia, as well as other respiratory infections among the older adults, in order to promote their health and wellness throughout their lifetime. Thank you very much. I think that was the last slide.
Okay,
Back to you, Steph.
thank you so much, Dr. Poblete, for that very educational presentation. And thank you for always considering the well-being and the quality of life of our senior citizens. So at this point, we would like to acknowledge Dr. Angelo Sakitan, National Immunization Program Medical Coordinator from the Pasig City Health Office. He is the representative of Pasig City Health Officer, Dr. Joseph Panaligan. So thank you, Dr. Angelo, for joining us.
Good morning.
Hi, Doctor.
Yes po, share ko lang po yung screen ko. Pantay lang po.
Sure. Doctor, would it be possible for you to turn on your camera?
Okay. Is
Yes,
it,
para makita
okay
naman po namin na artistahin kayo, Doc.
lang po.
Hi, Doc.
Hello
So once
po.
again, Dr. Angelo will be sharing with us or discussing Pasig City's best practices and preparedness against influenza. So Doc, the floor is yours.
Good morning po. On behalf of Dr. Paniligan, I am Dr. Sakitan and I will be presenting the Pasig City's best practices and preparedness against influenza. So, just like what Dr. Bravo said, prevention is better than cure. So here in Pasig, we encourage our the community to practice the proper minimum public health standards, which is proper wearing of face masks, social distancing, and frequent hand hygiene. And secondly is the vaccination. Uh, and uh, eh, if ever the patient, if prevention does not work and patient got infected, our department offers services like consultation from the barangay health center. So, for the best practices of Pasig LGU, this so for the vaccination activity, we involve different sectors of the community, such as the Office of the Senior Citizens Affairs, the Persons with Disability Affairs Office, and the Homeowners Association. Here in Pasig, we vaccinate our senior citizens in their community, unlike in other LGUs that the senior citizens are required to go to health centers or in the city hall to get vaccinated. Here, here in Pasig, we go down to the community and ask for the different sectors to disseminate information to where or when the vaccination activity will happen. And we also ask them to provide us a list or master list of individuals, senior citizen individuals, and person with disability or other immunocompromised individual in the community to make it easier to access the vaccination activity. Here are some photos of our vaccination activity. Thank you. That would be all.
Okay, thank you so much, Dr. Sakitan, for sharing with us and our media friends Pasig's efforts and activities to protect our senior citizens. So now that we've heard our esteemed experts talk about the different ways we help we help protect our older adults, especially during the rainy season, let's hear the reaction of a renowned health expert. So he is the chairman of the Adult Infectious Diseases and Tropical Medicine Fellowship Program at San Lazaro Hospital, a clinical assistant professor 1 at the College of Medicine from the University of the East Ramon Magsaysay Memorial Medical Center, also the chair of the Infectious Diseases section at the University of the East Ramon Magsaysay Memorial Medical Center. He is also the vice president of the Philippine College of Physicians and the former president of the Philippine Society for Microbiology and Infectious Diseases, or PISMID. Please help me welcome Dr. Ronjean Solante. Thank you, sir, for joining us today. Hi, doctor.
Hi, Steph. Thank you. Can I just share one slide just to, again, reinforce the discussion, why the
Yes,
importance of protecting the elderly, okay? So to recognize the value of how the previous speakers like Dr. Coronel and Dr. Poblete mentioned about the complications of influenza. And we know that influenza is not just a respiratory infections. Second, we have a growing population of the elderly, and this makes this population highly vulnerable, not only to influenza, but also to other respiratory tract infections, including pneumonia. And of course, we have a lot of experience with COVID-19. So what is really important here is that when we put value of vaccination among this population, it's more of looking at why are we giving this vaccine? Why are we recommending this vaccine? One is that we need to decrease hospitalization. And decreasing hospitalization will also decrease the overwhelming capacity of our hospitals, much that we have an ongoing pandemic, and we also have other conditions like non-communicable diseases that most hospitals are taking care of. As much as possible, we want to protect this population because not just respiratory tract infection as a complication of influenza, they're also prone to pneumonia. And in fact, the data coming from PhilHealth, it's the number one reimbursed infection or disease for the past 6 years now. And although we don't know how much of this or how many of these are bacterial or influenza, but again, it boils down that population with these vulnerable conditions are always high risk for community-acquired pneumonia. And that includes influenza as one of those causes. We also would like to protect this population against exacerbation of other infections. Not to mention that decreasing hospitalization among this population will also have an implication in decreasing complications like diabetes, stroke, and even hip fracture. And the more important, with a lot of data now, that influenza has an indirect effect in terms of our heart, and that leads to cardiac complications. And I know a lot of cardiologists are not aware of this, that most of their patients may be admitted because of myocardial infarction or heart attack, but this is probably triggered by an overt respiratory tract infection, and most likely it's because of influenza. And we know that when we prevent hospitalization, we also would like to prevent mortality. And there are compelling data that when you give influenza vaccine, it can lower the risk of mortality and adverse event to as high as 36 to 40%. Okay. And when you look at a 60 years old or 65 years old with a 36 to 40% reduction of this adverse event, that's already significant. Okay. But what we would like to indicate also that we know that there is a vaccine, we know the consequences of influenza, but there is also an ongoing challenges in terms of influenza vaccination in this population. And most important is really the low vaccination rate. Comparing the Philippines with other countries, the Philippines doesn't have any government program on adult vaccination. Okay, the most that we can have in terms of recommendation is the Senior Citizens Act, which indicated there that all 60 years old and above should receive pneumococcal and influenza vaccine. But again, these are recommendations. So a lot of times, these are not implemented, depends on the funding of the local government, and I'm congratulating the Dr. Sakidan a while ago for presenting the important steps and program that they have for the senior citizens in terms of enhancing vaccinations, particularly influenza vaccination. So on that note, we know that vaccination campaign in adults in the Philippines is always private physician driven. So it's out of pocket coming from the patient. And if this is the program, you always expect that there is limited vaccination coverage. The other side here is that the medical societies are very important also in terms of the advocacy on vaccination. And I would like to, again, acknowledge these societies who are consistently doing advocacy program like the Philippine Foundation for Vaccination, the Philippine College of Physicians, the Philippine Society for Microbiology and Infectious Diseases, of course, the Philippine Society of Geriatric Medicine, which is also a component society of PCP, and also the Family Physician Group, the Philippine Association or Academy of Family Physicians. Now, it's important, no? With this new administration, I hope the DOH role should also be strengthened. We are now moving forward for the universal healthcare, and part of the universal healthcare is not only strengthening the infrastructure, not only strengthening how to treat patients, especially the indigent patients, it's also giving equal opportunity of people to have prevention, to prevent infectious diseases. And most likely, probably part of that is always vaccination when we talk about prevention of infectious diseases. So with that, I would like to thank the media and also the organizing committee for this very important endeavor and activity, enhancing our awareness on the role of influenza vaccination among this vulnerable population. Thank you.
Thank you so much, Dr. Solante, and we always look forward to your inputs because we learn so much from you. So now the floor is open for questions. Just raise your hand if you want to ask, or you can also message me in the chat box, or you can also message Joanna there if you want to be recognized. So please state your name and the organization you're from. So thank you. Any questions, guys? Any questions from the floor? Okay, so while we wait for our media friends to ask their questions, let me ask a question first. So my first question, this is for Dr. Coronel. So doctor, we've learned that you were one of the pioneers who strongly fought to have a flu immunization in place for senior citizens. Can you tell us, Doc, what are your thoughts on its progress or current status? What's your assessment? And do you have any suggestions or recommendations? Dr. Coronel.
Well, as on the DOH side, government side, Jean, di ba tayo yung magkakasama no, ng technical working group on the giving of vaccines to flu and pneumonia to indigent senior citizens?
Yes,
As
yes,
the
Dr.
statistics,
correct.
yeah, as the statistics which I've shown from DOH, no, up to 2021. Hanggang ganun lang, kunting-kunti lang. Pero as a private, sa mga medical societies like PFB, masyadong maganda ang programa on how to entice people, especially the older people, to get vaccination against flu and pneumonia. And pero marami pa ring hesitancy on the part of this, the senior citizen. Kasi mayroon yung ageism, ano? What is important are the relatives. May discrimination kasi matanda na. Yung mga kamag-anak mo, kunyari, akong matanda na sa bahay, gusto kong magpabakuna. Sasabihin ng anak ko, yung mga apo ko, Lola, wag na, matanda ka na. Sabing ganyan. So kahit gusto ng mga matatanda magpabakuna, wala rin silang magagawa eh. They will not bring them to the site of vaccination. Sana kung kagaya sa Pasig, they go to the house to vaccinate all the elderly. Pero sabi nga there was a webinar on influenza last week sa Singapore ni Dr. Leong, to increase the vaccination rate coverage, especially sa mga younger, hindi mga older people. Mga companies should be tapped to talk with the administration of the company or the school to have vaccination kasi influenza is one of the diseases na mayroong nagkokos ng absenteeism. So, madalas nag-a-absent ang bata o yung mga empleyado nag-a-absent because the index case of flu at home for the parents, grandparents, yung mga bata na galing sa eskwela. Kaya mabuti nga mayroong expanded immunization program ang government. Lalo ng PFB, talagang pinupus nila yan. So, tapos hindi lang yon, may presentism din, nagkokos ng presentism ang influenza. May nararamdaman na yung pasyente o yung healthcare workers o yung mga empleyado, pumapasok pa rin. So, it's nice to talk with the administration of the company and schools and others to explain the benefits of influenza. Sabi niya, yung presentism at saka yun ng absenteeism, tapos days loss of work, tapos yung wages nawawala. So, we have done that in some companies and it works. Kaya, unti-unti lang yan. Hindi mo mabibigla yan, Steph.
So, Dr. Coronel, one step at a time. I mean, nandun naman na tayo, everything's in place, pero kumbaga konti-konti pa rin para marating talaga natin yung parang pinaka-objective natin to immunize all our senior citizens. Thank you, Dr. Coronel. I think we have a question from Rain de Ocampo from Rain Check Blog. Rain, would you want to ask your question? Hi, Rain.
Hi, hello. Can you hear me, please?
Yes po. Go ahead.
My question is, as we have experienced this pandemic with even with the immediate danger, many have opted not to get vaccinated still against COVID kahit na free yung vaccines. What do you think would be the most effective strategy to get the numbers up with regards to flu and other vaccines, especially on the elderly?
I think for this one, maybe Dr. Bravo can answer first. Dr. Lulu?
Thank you, Rain, and thank you, Steph. Thank you for all the panelists. Actually, that question, Rain, is our $64 question. How do you increase? How do you convince people to get vaccinated? And not only people, but the elderly. You know, the elderly was not used to getting vaccine because our EPI program started in 1974 to 76. Mga bata lang po ang binabakunahan nun. So yung mga elderly na ngayon ay 60, hindi po yan nakaranas ng pagbabakuna. At hindi nila alam na dapat pala ay nabakunahan sila. Kasi po, mga 40 years pa lang itong ating National Immunization Program. So ano po ang kailangan? Sabi mo nga, Rain, aba, kayo po ang makakasagot niyan din. Kasi sa akin po, ever since my career in 1974, ako po ay 72 years old na. And since the time on, I've been working on prevention kasi infectious disease po ang aking expertise. Kami nila Dr. Solante, ni Dr. Coronel, si Dr. Poblete sa Geriatrics. Pero importante po talaga ang pangangalaga na huwag magkasakit ng mga infection na mapiprevent ninyo at bakuna po since time immemorial ang talagang makakapagdala niyan. Ngayon, paano po natin gagawin? Siguro po, meron din kayong suggestion, hindi ho ba? Meron din kayong mga kaalaman na kasi hindi lang po nangyari ito ngayon. Matagal na po nating pinag-uusapan ito. At I will tell you, kung gusto nyo pong makipag-workshop sa amin, kayong mga media, paano natin ibabalik or i-restore? Kasi po nung 2015, mula nung 1990, si Dr. Flavier po pinangunahan ng pagbabakuna. At yun po ay tumagal ng almost 20 years since 1990. Kaya lang po, nagkaroon talaga ng bulilya. So alam nyo na kung anong ibig kong sabihin. At kung ibabalik po natin ang kumpiyansa ng mga tao sa bakuna, medyo malaking trabaho po yan. Pero maliit lang po kung pagtutulong-tulungan natin. I'm ready to workshop with you. I'm ready to get all of you media to help to ensure that our elderly, our Filipino people get the accessibility, get the education, get the right information na hindi po bubulilyasuhin ng mga tao na wala naman po talagang expertise at gusto lang manira. Okay po ba? Thank you.
Thank you so much, Dr. Bravo. And just like what Dr. Bravo said, kailangan po talaga namin ng tulong ng media para po tumaas yung awareness pagdating po dito sa flu vaccination sa ating senior citizens. So I think we have a related question regarding this one. This is for our panelists po. Anyone can answer. Are you working with any senior organizations like kunwari senior citizens organization tulad po ng Office of the Senior Citizens, National Commission on Senior Citizens, and Coalition of Services for the Elderly pagdating po sa flu immunization? Maybe Dr. Poblete can answer first. And then Dr. Solante. Palit po tayo na. Yes, Doctor.
Okay. St. Luke's Geriatric Center has been has a close relationship with COSE, yung ating Coalition of Services for the Elderly. They have been assisting them and continue to do so if their requests will reach us soon. We also work with OSCA in our capacity as experts. We give certain topics for them. We deliver some lectures and tips. Sometimes meron kaming conversations na ano lang yung dialogues, those dialogue forums. And more importantly, we try to spread across the Philippines yung educational part ng ating advocacy on immunization by doing a caravan. Yung caravan namin would be regional. They will touch on immunization, specifically and other forms of prevention of diseases in the elderly. So nakafocus kami sa preventive geriatrics. Ang highlight na yung ating immunization, specifically flu and pneumonia immunization. So yes, we are in contact with organizations, even with the Congress. Meron tayong senior citizen na merong parties concerned with senior citizens, not just one. We have senators and congressmen who are making bills, developing bills for senior citizens, in spite of the existence of RA 9994 or the Expanded Senior Citizens Act of 2010. Meron pa silang gusto pang improve, and we're working closely with them para to address and to make them relevant. So yes, we have a lot of working relationships with different organizations.
Thank you, Dr. Poblete. Maybe let's have Dr. Solante.
Yeah, thank you, Steph. No, I'd just like to add what Dr. Ed and Dr. Lulu mentioned. No, I think key factor here is yes, the private organization, the private physician, the medical societies are constantly doing works in terms of advocacy. No, but again, the question is, does advocacy translate to more number of vaccinations? That's always the gap. Okay. And that gap has been identified already because of the out-of-pocket costing. And when you have COVID-19 vaccination, which is totally free because of an EUA and because we are in a pandemic, that can be an example why we need a government, a national government involvement in terms of vaccination, or prioritizing the 60 years old and above. Since we already have the Senior Citizens Act, it's just a matter of implementing and putting more funds on this. No? And currently, local governments are the ones implementing this, but it may not be enough. It may not be sustained. Okay, so we need to work more. And my thinking here is that once we have the universal health care, okay, once it will be fully implemented, because as of now, it's not yet fully implemented, and we're still in the process of identifying hospitals, identifying specific APICs and other hospitals for the implementation. Part of that is really on prevention and working on this universal healthcare app. We will, I think, for me, focusing on prevention, focusing on vaccination, will also address some of the issues in terms of the gap and how the government can give more funds and implement vaccination, and not only with flu, but also with other vaccines like pneumococcal vaccines.
Thank you, Dr. Solante. Do you want to add anything, Dr. Coronel?
I think all has been said.
Okay, Dr. Bravo, would you want to add anything?
Actually, sabi ko nga, because I've been living my professional career mostly on vaccine, and I really feel that once we have all of you here working together, ang slogan ko na lang ngayon is working together. Kasi there was a time, alam niyo po ba, parang yung PFB lang at saka PSMID, di ba, Dr. Coronel, ang talagang nagbibigay ng mga informasyon. Pero mula po nung magka-COVID, nakita nyo naman, biglang nagkaroon na lahat ng mga tao, pati yung mga hindi eksperto, sabi expert na rin daw sila sa bakuna. Ang masama lang, okay lang po kung ang sinasabi nila ay yung tama. Pero meron pong sinasabing eksperto sila ay nananakot naman po at sinasabing nakakamatay ang bakuna, lalo na sa matatanda. Aba ay hindi po yun ang gusto natin. Sabi nga po ni Pope Francis, vaccination is an act of love. Pag-ibig po. Hindi po ba napakaganda ng sinabi niya? At totoo naman po yun. Kami po ay talagang nagre-respeto na ang mga tao na makakapagbigay ng kaligayahan, pag-ibig, kalusugan sa mga pamilya nila. At hindi lang po sa pamilya, sapagkat ang bakuna po ay hindi lang pampamilya. Yan po ay pang-sosyedad. Yan po ay pang-komunidad. Yan po ay para sa bayan natin, para tayo po lahat ay maka-access. Sabi nga po ni Dr. Poblete kanina, kailangan po magsama din tayo at yung mga nakakapagbigay ng libreng bakuna. Kasi nga po, sinabi rin ni Dr. Solante, kailangan din po ng libre. Kasi nga po, marami po tayong kababayan na hindi maka-afford. At nangyari yan sa COVID. Nakita nyo naman, tumaas talaga dahil free vaccines. At yun po namang tinatawag nating Senior Citizens Act of 2010 ay nagbibigay po ng libreng flu at bakuna na pneumonia Tandaan niyo po yan. Nalimutan ko ang Republic Act number niyan. Pero ang tawag po dyan, Senior Citizens Act. Naginawa po yan ng mga geriatrician, ng kami po noon. Ako po ay NIH director. Nung tawagin ako sa Senado para sabihin, maganda ba to? Abay, maganda po yan sapagkat magbibigay hindi lang ng welfare sa mga elderly na mahihirap, kundi pangalagaan na huwag silang magkasakit ng flu at pneumonia. Sapagkat ang akala ng mga tao, porket matanda na kayo, get rid na lang kayo. Hindi po ganon. Hindi po ba? Mahal natin ang ating mga nanay, mga lolo at mga lola. Yan pong pagmamahal na yan ang ina-appeal ko sa inyong mga media. Vaccination is an act of love. Talaga pong kung mahal ninyo, si Dr. May Montellano, lagi niyang sinasabi yan, tuwing Pasko, tuwing Valentine's Day, tuwing meron siyang maibibigay na bakuna sa kanyang staff, sa kanyang mga vaccination, yan po ginagawa namin. Tuwing meron kaming libreng bakunang maibibigay, tuwing meningitis day, tuwing pneumonia day, nagbibigay po kami, humihingi kami sa DOH, binibigay po namin as vaccination upang patunayan sa mga tao na kung mahal ninyo ang inyong mga kamag-anak, nanay, tatay, lolo, lola, aba, huwag niyo po silang pabayaang mamatay sa flu at sa pneumonia. Sapagkat yun po ang papatay sa kanila. Nasa top 10 morbidity, mortality po ang pneumonia at influenza para sa 60 years old and above. Tingnan niyo po ang ating Philippine statistics. At kung tunay na mahal niyo ang inyong mga lola, lanay, huwag niyo po silang pabayaan. Mura lang po yan. At libre pa kung kayo po ay indigent. At sabi nga ni Dr. Solante, pag dumating na ang universal healthcare, hopefully makapagbigay tayo ng additional contribution dyan. Maari pong maging libre na ang bakuna para sa lahat, hindi lang sa mahihirap. Di po ba? Yan po ang pangako ng universal healthcare. Magbigay ng bakuna, hindi lang sa elderly, kung hindi doon sa buong mangangailangan yan. Maraming salamat.
Thank you so much, Dr. Lulus. Nag-agree po talaga kami, vaccination is an act of love, and we're looking forward to free vaccination for all. So in relation po doon sa topic na yan, meron po tayong question dito from from Rory Visco. Rory, do you want to personally ask your question? I think this is somehow related to the statement of Dr. Solante a while ago about having a new government. So Rory from Business Mirror, you are recognized. Rory. So I think I'll just ask the question na lang. So his question is, will having a new government impact the national immunization plans for the elderly? And do you expect continuity or recalibration of these plans? Anyone can answer po. Who wants to answer, Dr. Lante?
Yeah, yes, that. So, okay. The current government is also prioritizing vaccination, but because of the pandemic, the priority was shifted towards the COVID-19. But since our COVID-19 data has stabilized now, and we now have lots of those who received the primary vaccine series, and we know that the possible impact of the influenza will also be felt after the pandemic. So it's just proper that most likely the next administration will also endorse the importance of vaccination, and not only for the elderly, but that also include for the whole of the population that will really benefit vaccination. No? Kasi hindi lang naman natin pinipinpoint ang mga elderly dito, no? But everyone, particularly with vaccines that has impact in preventing mortality and decrease hospitalization. And as I've said, that as we move forward, and the next focus will be of the new administration of the Department of Health will be on the Universal Healthcare Act, which we hope will also address the importance of vaccination.
Thank you, Dr. Solante. So in relation po dun sa pagkakaroon natin ng Universal Healthcare Act, we have a question from Milet Season. Ms. Milet, do you want to ask your question? Miss Millet from milletseason.com. Hi. Hi, ma'am.
Thank
Good
you.
afternoon.
Hi. I wanna ask anybody from the panel maybe able to answer the question. How do we bring equal opportunities for flu and pneumonia vaccination to elders living in far remote or tribal areas?
I think Dr. Bravo. Yes, please.
Milet, napakaganda ng tanong mo at yung kanina rin na tinanong ni Steph, no? Kasi
Thank you po.
ang WHO ay merong inlano na ang tawag Immunization Agenda 2030. Nag-umpisa yan noong 2020 pagkatapos ng Decade of the Vaccine. Ang target nila ay mabigyan ng bakuna lahat ng tao, accessibility. The benefit of the vaccine must be given to every age group, everyone, everywhere, to address inequity. Alam mo, ibig sabihin ng inequity, di ba? Yung dapat, maski sino ka, babae, lalaki, matanda, bata, mahirap, mayaman, ay pwede kang makakuha ng bakuna. You have to address inequity. At kung nakinig ka kay Bill and Melinda, si Bill Gates, dun sa kanyang isang graduation speech, yun ang kanyang tema, inequity sa bakuna. Yan ay talagang napaka-importante yan tanong mong yan. Paano ba mangyayari yan? Ang WHO, sinabi na dun sa COVID, maganda ang response natin sa COVID response ng Pilipinas, di ba? At yung bakuna naman, sinasabi ko nga, na mula noong 1990, binigyan ng award si Dr. Flavier dahil ang pagbabakuna sa Pilipino ay tumaas hanggang 95%. Napakaganda sa children. At nagkaroon lang ng bulilyaso nang pumasok ang politika. And this is where your new government will be very, very important sapagkat ang bakuna ay hindi dapat mapolitika. Sapagkat ang kalusugan, ang pagbabakuna, ang pag-aalaga sa mga tao ay hindi nararapat na ipamulitika sapagkat tayong lahat ay may karapatan na magkaroon ng tamang impormasyon, tamang mga accessibility sa kalusugan. At kung sa palagay mo ay kayong mga media ay may tunay na boses, may responsibilidad na ipaalam sa mga tao, kayo po ang aming tinitingnan na makakagawa din yan. Kasi kami, nakikipag-usap kami, kapwa namin doktor, kung minsan ang tanga-tanga namin, hindi namin alam. Akala namin kami lang ang marunong. Hindi po ganun. Lahat po tayo kung magtutulungan. Meron tayong kapasidad na magturo sa iba ng tunay na kahalagahan ng kalusugan, ng pag-aalaga sa bawat isa. Abay, napakarami naman po dyan. Bakit ang pakikinggan ng mga tao ay yung mga eksperto supposed to be na nagkukunwari lang peke? Hindi po ba? Bakit po yung peking eksperto ang inyong paniniwalaan? Kaya po natatakot ang mga Pilipino. Abay, kung peke lang po, ay ba nung Middle Ages po maraming nagtitinda ng gamot kung ano-ano na makakapagpaganda daw sa katawan o anong nangyari, di ba? Nawala din sila. Ang tunay po na tumatagal at nagiging sandigan ng tunay na global health at kalusugan, eh yun talaga pong pinag-aralan, dumaan sa mahabang proseso, naging panatag ang mga eksperto, nagsama-sama sila upang ibigay sa mga tao ang tunay na kahalagahan ng pagbabakuna. At yan po ay 230 years na. So wag po tayong bayani po tayo, hindi lang po doktor ang bayani, kayo rin po ay bayani kung inyo lang iisipin na ang bawat sabihin nyo sa media ay maaring makapag-influensya sa lahat ng makikinig, magbabasa ng inyong sinasabi. Hindi po ba? Napakalaki po ng role nyo. Kaya ako po, maski may sakit kung minsan, maski na may nararamdaman, basta sinabi niya, let's talk to media, yes! Sapagkat kayo po ang nararapat talagang magbigay ng tamang impormasyon. Huwag po kayong magbigay ng fake news. At piliin nyo naman po yung mga eksperto kagaya ni Jean Solante, ni Dr. Coronel. Yan po si Dr. Coronel, awardee po yan ha, sa clinical practice ng Dr. Jose Rizal Memorial Award. O, diba? Yung pong tunay na eksperto, wag po kayong maniwala sa gusto lang magbenta ng gamot nila. Sorry, thank you.
Thank you, Dr. Lulu. Sir Tony from TV5 will recognize you in a bit. Meron lang po related question, yung equal call for vaccines. And this question is for Dr. Solante. So, Doctor, may question dito. For immunization programs, developed nations are now utilizing enhanced influenza vaccines to protect their elderly population. In the Philippines, trivalent influenza vaccines are used in the public vaccination program for senior citizens, while quadrivalent influenza vaccines are administered in the majority of private clinics and hospitals. Can you share us your thoughts, Doctor, on this in the light of the call for equal access to vaccines, particularly during the COVID-19 vaccination rollout?
Yes, okay, thanks for this question. No? Now, whether it's trivalent or quadrivalent, both of this vaccine formulation can protect. No? Meron lang leaning towards the trivalent sa mga public because of the cheaper price over that of the quadrivalent. Okay, but I think moving forward, the trivalent, most of the pharmaceutical companies now will be leaning towards the quadrivalent over the trivalent. No? So in a way, magiging equal na yan. Magiging ang available na lang ang quadrivalent kasi tatanggalin na yung trivalent. No? So, yun lang yung nangyayari. It's not about equity, but it's about the affordability of a trivalent over that of a quadrivalent. But whether it's trivalent or quadrivalent, both of these can protect. Ang importante, merong bakuna tayong binibigay. And the effort by the public sector in terms of buying the trivalent is also as important as the private sector na nagbibigay din ng quadrivalent. It all boils down na may binibigay tayo, no? And that protection, especially both of these vaccines, contain the more important. All of the serotypes here are all important, no? Whether it's the influenza A or B. So sa akin, hindi ko nakita ang problema na yan. Ang napaka-importante nga yan na ano dito, nabibigay, whether it's trivalent or quadrivalent.
Thank you so much, Dr. Solante. So, Mr. Tony from TV5, I think you have a question, sir.
Yeah, good morning, Ma'am Steph. Thank you so much for the opportunity. Sa ating pong panels, magandang umaga po. Dito po sa Central Luzon, bahagi po ng Pilipinas, marami po tayong IPs, no? Yung po mga indigenous people or yung mga katutubo na tinatawag from the different provinces like Aurora, Zambales, Bataan, Pampanga, and Tarlac, and Bulacan. Papaano po ninyo ikukumbinsi ito po mga katutubong ito na natatakot po magpabakuna? Kasi ang katwiran po nila ay matagal silang nanirahan sa bundok. Hindi naman sila inabot ng pandemya or any viruses. So, paano po? Since sabi po ninyo kanina ay lahat kailangan dumaan magpabakuna. Paano po ang ginagawa ngayon ng ating pong national government para to convince all those IPs po sa atin sa Pilipinas? Thank you.
Thank you, Sir Tony. Maybe Dr. Coronel can answer the question and Dr. Poblete afterwards.
Ang importante kasi, lalo yan sa mga katutubo nga, wala silang, kagaya sinabi ni Dr. Lulu, wala silang bakuna. Pinanganak sila doon. At saka wala naman sigurong mga doktor doon. Kasi importante talaga is education, information. So siguro, ang ano ko, sana isa sa dalawang ito na panelist ay maging Secretary of Health, no? Para makapunta tayo sa mga lugar na yan, to educate yung mga tao doon. Kasi may mga nakakapag-aral na naman doon eh. Na yung kagaya yung mga sa barangay dyan, isama natin para kausapin sila, sabihin kung ano nga mga benefits ng mga bakuna. At talagang mahirap talaga. Hindi lang sa atin sa Pilipinas, kahit sa New Zealand, kasi ang anak ko nandun sa New Zealand. Kaya may tuwataas ang COVID doon kasi yung mga native ay ayaw magpabakuna. Even yung mga pharmaceuticals na mga gamot na ginagawa ng mga pharmaceutical companies. Ayaw nila. Herbal lang sila. Kaya mahirap talaga. Mayaman na ano na yon, mayaman na bayan na yon. At the Prime Minister cannot do anything about them. Nagpipikit nga sila doon sa embassy, sa kanilang parliament. Kaya kailangan puntahan sila para kausapin yung mga leaders nila, para sabihin sa kanila na ganito, ganyan. Sabihin ko anong benefit ng mga bakuna. Kasi mahirap talaga yung question mong yon, sir. Kaya kailangan act of love talaga to go to them. You have to go to them. Ako, payag ako, punta ako sa Zambales, taga-Zambales ako doon. Maraming ita doon.
Thank you so much, Dr. Coronel. Dr.
Sana,
Poblete?
sana maging Secretary of Health ang isa sa inyong dalawa yan, si Jean at saka si Lulu. Lulu, tayo.
Thank you, Dr. Remy. Pero marami pong posible talaga na merong magagawa para sa ating mga Pilipino. Kung isa sa isip lang po natin na tayo po ay kailangang vigilant. Ibig sabihin, tayo po ay may boses. Kung kayo po ay nag-iisip na mag-demand ng bakuna, bakit po hindi? Sabihin niyo po sa kanila na kailangan natin ng bakuna para magkaroon tayo ng accessibility. Pero gusto kong sagutin yung tanong ni Tony kanina, Tony Arsenal, about paano mo makukumbinse yung mga katutubo. Isa lang po ang importante dyan, yung datos. Meron po tayong datos na kung kayo po ay hindi bakunado, sa bawat 1,000 na maipapanganak na hindi bakunado, nandun kayo sa bundok, maari po na 150 ang mamamatay bago magkaedad ng 5 taon. Marami po ang mamamatay. Samantalang kung kayo ay bakunado, isa bawat 1,000 po na ipapanganak, baka po ang mamatay lang or ang hindi makasurvive ay mga 10 hanggang 20. Hindi po ba? Yun po ang nangyari sa pagbabakuna. Kaya po sinasabi natin na vaccination save lives. Sabi nga natin, hindi yung bakuna, kung hindi yung pagbabakuna. Hindi ba? Yan po ang nangyari. Ito pong 220 or 30 years ng pagbabakuna. Yun po ang datos na maari nating sabihin upang sila ay makumbinsi. Ang medisina po ay progresibo. Ang bakuna po ay progresibo. Ang atin pong mga tao, kung nung Middle Ages, 45 years lang po ang kanilang longevity. Nakita nyo naman, pinresent ni Dr. Poblete kanina sa Pilipino, sa babae daw, 74 na ang expected life. Ako po, 72. So, nagtatanong ako, sige, may 2 taong pa ako, diba, sa female. Pero sa Japan po, alam nyo ba, 85 ang kanilang expectation. At sa influenza po, alam nyo ba, isa ang Japan na nanguna sa pagbibigay ng flu sa kanilang elderly. Alam ko po yon kasi nung 1990, nandun po ako sa Japan. 1 buwan po akong nakipag-exchange scientist. Nakita ko po kung paano nila inalagaan ang kanilang elderly. Gumagawa sila ng flu vaccine para lang sa elderly nila. 1990s po yun. At ngayon po, masasabi nyo, isa ang Japan, hindi po isa. Ang Japan ang may pinakamahabang life expectancy sa buong mundo. Sa Pilipino ho, sorry, pero hindi po tayo umaabot sa ganong parameter. So datos lang po. Tingnan po natin ang tunay na datos. Ang bilin ko lang po, yung tunay po, wag po yung peking datos. Kasi marami din pong lumalabas sa social media. At yun po kung minsan ang nakakasama ng loob. Kasi kayo po kung minsan, hindi po kayo hindi yung media, ang mga tao po, isineshare, nakakita ng sensational news, isi-share na agad. Hindi man lang chinecheck kung yan po ay makakabuti or makakasama sa ating mga Pilipino. Sana naman po, tayo naman po ay mga intelihente, tayo naman po ay may pinag-aralan, tayo naman po ay gusto rin na maging malusog at mapagmahal ang ating mga mamamayan. Sana naman po ay maging marunong din tayong tumingin kung ano ang dapat nyong i-share sa social media. Ito po sana yung isusulat nyo, i-share nila. Pero yung pong is-share na mga peke at mga sasabihin nakakamatay ang bakuna, ay hindi bali na, matanda na yan. Hindi bali nang mamatay yan. Hindi po ba? Napakasama naman nun. Hindi po ganyan ang Pilipino. Tayo pong mga Pilipino at mga Asians, mapagmahal po tayo sa ating pamilya. Tayo po ay sabi nga na, di ba Dr. Poblete, ang mga geriatrician, sabi nga nila, quality of life, tayo, maski na naghihirap tayo, ang ating mga elderly nagtatrabaho para din sa mga anak nila. Tumutulong
Correct.
sila hanggat maaari. Ibigyan din po naman natin sila ng pagmamahal na makukuha natin sa pampahaba ng kanilang buhay at ng kwalidad ng kanilang buhay. Thank you.
Thank you, Dr. Bravo. I think Dr. Poblete, you want to add something?
No, I think Dr. Coronel also outlined it well. The main focus should be on education. Yung aming caravan na nagagawin, we focus on far-flung areas. Hopefully, we reach the indigenous people or the care providers of the indigenous group, because ang aim namin is to spread beyond the usual group of doctors or care providers yung message of vaccination or immunization. So we hope that when we're successful, we'll give you a good evaluation of the program, and that will be able, hopefully, increase the numbers of vaccinees in the future. Thank you, Steph.
Thank you, Dr. Poblete. And Sir Tony, sana po nasagot po yung tanong ninyo. Maraming salamat po sa tanong ninyo. Ang dami pa po nating questions and medyo overtime tayo. So I think we're down to our last two questions. The next question is for Dr. Sakitan. So sir, yung question natin dito, the city of Pasig is considered to have one of the best practices when it comes to flu immunization for senior citizens. Can you give your advice daw po to other LGUs on strengthening their flu vaccination programs? And yung isa pa pong question na kasunod, has Pasig received its flu vaccine allocation from the DOH this year? Doctor?
Yes po. Good morning po ulit. For the best practices, siguro po yun nga po yung ini-involve po namin yung ibang sectors ng community like yung sa senior citizen, and then for the PWD and the homeowners association. So parang sila kasi yung mas nakakakilala sa mga tao sa community nila. So siguro dagdag na rin dun sa question ni Sir Tony kanina kung paano may encourage yung mga indigenous people on vaccination. So from there, we offer the data and information about the advantages of being vaccinated. And from there, pipili tayo kung sino yung mga willing na magpabakuna. And then, yung mga nabakunahan na yun, sila na mismo yung mag-a-attest na safe pala itong magpabakuna or hindi naman pala siya nakakasama or delikado sa kalusugan natin. So, mas paniniwalaan kasi sila ng mga ng community kasi kasama nila yun kasama nila yun in their daily life. So mas paniniwalaan sila in their
Kung sila yung trust, sir.
Tapos yung for the supplies, may dumating na flu vaccine, not sure, hindi ko lang po sure kung sa DOH po galing. Pero ayun, we are currently meeting for kung paano po yung gagawing activity for the vaccination. Pero meron pong dumating na supplies.
Okay.
And then
Thank you so much.
Yun po. Thank you.
Thank you, Dr. Sakitan. So now we're down to our last question. Thank you so much po sa lahat ng nagpapadala ng tanong. Pasensya na po at hindi namin ma-accommodate lahat because we're over time. But the last question is for our panelists, para sa inyo pong lahat. Unahin po natin si Dr. Coronel. But basically the question is, do you think medical groups and other stakeholders should initiate creating a coalition championing flu immunization for older adults. Kasi Dr. Coronel, we've seen in your presentation the very big difference between the uptake of flu versus the pneumococcal vaccine. So do you think medical groups and other stakeholders should initiate a coalition championing flu immunization for older adults?
Yes, that is a very good move to do at this point in time, so that your vaccine hesitancy will be reduced o mawala, and increase the coverage of vaccination to all. So, importante yung equity ng vaccination is very important also. So we have to tackle all this. Lahat ng mga challenges against vaccination should be tackled by this group. Yeah, that's a good move.
Thank you, Dr. Coronel. Let's have Dr. Poblete po.
Yes, I think having a common agenda, it's a good enough reason para magkaroon tayo ng coalition. In coalitions, there will be more advantages, like you'll be able to exhaust all avenues of putting a message across that we need to immunize everyone and try to reach that equity that we're trying to achieve. And we think that with the coalition, we'll be stronger as a voice in waking up the new government that's going to be installed soon on the plight of the Filipino elderly and the need for preventive geriatrics. Thank you, Steph.
Thank you, Dr. Poblete. Let's have Dr. Bravo.
Thank you, Steph. Actually, flu season na ngayon. June to September is usually with August as the peak. Ito po yung maraming maaaring magkaroon ng flu, lalo na ang elderly, lalo na po ang pagkakaroon ng sangkatutak na problema sa gamot at hindi lang yan sa ospital. Nasabi po na kanina na pag napakarami ang mauospital, pwede pong ma-overwhelm ang ating healthcare system. Kaya nga po yung pagbabakuna ay isang paraan upang hindi dumami ang mga pasyente sa ospital. Pero nangyayari po yan. Kasi pag nagpatong-patong, kasi sabi nga sa inyo, influenza season na ngayon, June to September. Aba, alam niyo po ba na dengue season din yan? At magkamukha po yung dengue at saka yung flu, na merong lagnat, pananakit ng katawan, di ba, namumula, masakit ang lahat ng kalamnan. At pagka po maraming nagkaroon ng sakit, ay talaga naman pong na-overwhelm. Parang war zone. Alam nyo naman siguro, hindi kayo napupunta sa ospital pagka ganitong season. Lalo na po pag August. Naku po, pati corridor ng aming PGH. Jean, di ba? Maski sa San Lazaro, napakarami, nasa corridor na. Ayaw po natin yan. Sapagkat meron naman po tayong pananggalang bakit po hindi natin gawin? At kung sakali man po na ang bagong administrasyon ay gagawa ng mga paraan upang maging malusog ang mga Pilipino, palakpakan po natin sila. Bigyan po natin sila ng mga ating nadadama upang maibigay sa mga Pilipino ang tunay na kahalagahan ng kalusugan, ng equity, ng pagbibigay ng access sa lahat ng tao, hindi lang sa mayaman, pati mas mahirap at matatanda. So, yun lang po, magtulong-tulong tayo. Yun po ang lagi kong slogan, working together, kagaya ng WHO. Kasi kami po ay sumusunod sa mga panubili ng WHO. Kasi kung kanino po, hindi po kami sumusunod sa politika. Hindi po kami sumusunod maski anong administrasyon ang ilagay nyo dyan. Tayo pong lahat dapat sumunod sa kahalagahan ng kalusugan. Magbasa po tayo. Ang science po, ang siyentipiko na mga eksperto na nagbabanggit at nagsasabi ng dapat nating gawin, yun po ang dapat sundin. So marami pong salamat at sana naman po makatulong tayong lahat sa pagsusulong ng pagbabakuna, hindi lang po sa mga bata, kasi ako ever since sa mga bata, pero yung pong matatanda, kasi ako po matanda na rin ngayon Pero talaga po, sa totoo lang po, napaka-importante po niyan. Sana po, magtulong-tulong tayong lahat. Over, Steph.
Thank you so much, Dr. Lulu. Of course, Dr. Solante.
Steph, I think the thoughts of the panelists, including Dr. Bravo, summarized everything. No, the importance of vaccination for all population, and also the collaborating part of how private medical societies can also strengthen the advocacy, and not only advocacy but also leading towards implementation, partnership with government, partnership with the Department of Health. These are very important to move forward. And this is really for the greater good of the population. We're not talking here of any benefit, but for the benefit of the greater good of the population, just like how we did it with COVID-19. And I hope the same platform will also be undertaken with other vaccination campaign.
Thank you, Dr. Solante. Habol po yung ating LGU, Dr. Sakitan. You have any insights on the call to create a coalition?
Yes po. Regarding po doon, same naman din po, yes po. Since yung theme naman po ng lahat ng panelists is yung prevention is better than cure. So yun po, parang kung mas sa akin kasi on my personal view, mas marami yung advantages ng pagiging bakunado versus sa hindi pagiging bakunado if meron man disadvantage ang pagiging hindi bakunado. So, yun lang po. So, for everyone advantage naman. Thank you.
Thank you, Dr. Sakitan. And thank you to all our panelists for taking your time today. So that's all the time we have for Q&A. So thank you for your enthusiastic participation. But before we end the program, we'd like to call on PCGM President Dr. Eduardo Poblete for a few words. Doctor?
This has been a fruitful event, and we were so lucky to have invited esteemed guests and panelists. And we are also lucky to have had so much support from our media partners. But we hope that this will not stop here, and this will just be the beginning of a good partnership towards a common goal of taking more care of our older adults, even beyond the care that is given to them by the government. We need your support right now in order to push forward a preventive intervention that is very, very crucial at this point, when we have proven that immunization will enhance our protection against even the COVID that we have at present in the ongoing pandemic. So we hope that there will be more events like this, and that more and more people will get interested, so that the education does not only stop or begin and stop here, but will be spread across the nation. And I hope that this will make a mark on each and every audience that we have there, so that they will also talk about immunization. It's enough for now to hope that they talk about it. And later on, we will hope that they do something about it. So magandang umaga po sa inyo lahat, at salamat po.
Thank you so much, Dr. Poblete. Thank you, Dr. Lulu Bravo. Thank you, Dr. Remedios Coronel, Dr. Angelo Sakitan, and of course, Dr. Ron Jean Solante. And of course, thank you to our media friends. Thank you for joining us. We will be sending you a press release regarding the event. And should you have any other materials, please don't hesitate to message our Media Relations Officer, Joanna Vier. So have a nice day. Stay safe po. Maraming salamat po sa inyong lahat. Thank you.
Thank you. Bye-bye.
Bye.
Thank you.